is CGTN, China Global Television Network.
The COVID-19 crisis has had a devastating global impact on economies and people, with over 1 million deaths reported so far. Scientists in several countries are currently in a scramble to develop and produce a vaccine for the worst pandemic the world has ever faced. There are several coronavirus vaccines currently being developed around the world. These have shown varying degrees of effectiveness, but the race to successfully release one to market continues. According to the World Health Organization, dozens of potential COVID-19 vaccines are in human clinical trials, with 4 of these being tested in South Africa. This week on Talk Africa, we look at how equitable the distribution of the completed vaccines is likely to be, and how will African countries fare in this process. I'm Beatrice Marshall. Welcome to Talk Africa. Now, one of the biggest challenges that will be faced when the vaccine is finished will be the logistical nightmare of producing and delivering 7 billion doses around the world. With wealthy nations already staking a claim to the lion's share of this vaccine, there are mixed feelings about how this process will affect Africa. My colleague Noel Mwakugu brings us some reactions from around the continent.
AstraZeneca is the latest company to announce a major breakthrough in the race for a sustainable COVID-19 vaccine. It is also the first outside the United States after Pfizer and Moderna. Here in Africa, many locals are adopting a wait-and-see attitude as the debate on the availability of these drugs now take the center stage.
It's up to the leaders to engage those who've come up with the vaccine and to see how they can roll it up to Africans. And yeah, there's hope if we engage with the first world countries and those who've come up with the vaccine.
If it is certified as okay for it to be administered on human beings, I think I wouldn't have any hesitation taking it.
For me, I've actually heard about these researches, but so far I've not been so much convinced about the COVID-19 issues, the way it's handled in Nigeria. So it makes me to be a bit skeptical about taking any vaccines.
While the World Health Organization and the African Union are pushing for these vaccines to be availed to African nations, some experts say it may be easier said than done.
Some of these challenges that governments might have. The first thing is laying your hands on the vaccine. The next thing is actually getting the vaccine distributed to your country. And then thirdly, it's setting up the logistics and distribution channels and storage and other things within your own country.
With poor infrastructure in Africa, storing the drugs may also be another challenge.
Now, the AstraZeneca one, you can keep at normal freezer temperature, which is just about 0 or thereabouts. The other two, especially the last one that came out, requires much lower temperatures to hold, which is not what you get in a normal fridge freezer. And it's also not what you get in normal hospital facilities for storing medicines and vaccines anyway.
The vaccine's efficacy has been rated at 90%. As more and more countries announce the groundbreaking moves against COVID-19 pandemic, the risk of vaccine nationalism posing, feeding into the world of politics is very high. Meanwhile, Africa and the rest of the world waits as the battle against the coronavirus pandemic rages on. Noel Mwakugu, CGTN.
And joining me now to unpack how Africa will be affected by the COVID vaccine development are Dr. Utibe Effiong, a public health scientist at the Michigan Health Medical Center, Professor Linda Gail Becker, Deputy Director of the Desmond Tutu HIV Center from the University of Cape Town, and Dr. Fiona Atuhebwe, the Africa Region New Vaccines Introduction Officer with the World Health Organization. Welcome all, and thank you for joining us on Talk Africa today. Dr. Fiona Atuhebwe, you're watching this from the World Health Organization. Now, many countries around the world saw a high number of coronavirus infections earlier on. Then we had a decline. And now we are witnessing what we see as a second wave of increased cases. How is the COVID-19 pandemic unfolding generally around the world?
Thank you very much. So as you just mentioned, the second wave is right here with us. It has come, it was expected, and now we are experiencing it. We thought that, for example, for countries who are seeing in the African region, numbers have started going down. Even globally, numbers have started going down, and suddenly we started seeing a rise in numbers as countries relaxed their preventive measures, as communities became complacent, as travel regulations were eased. We started seeing the increase in numbers, and Africa is not any different. We have started seeing countries that were seeing no cases or seeing a very minimal number of cases now with a spike of cases. So yes, the second wave is right here with us, and it is on globally, not just in Europe and the US.
Let's look at what's happening in Africa, Professor Becker, because South Africa had witnessed, a lot of increases at the very beginning, was hardest hit in Africa as we speak. But we are seeing an increased number of cases, though. Is that because of increased testing across the continent, or how are governments responding to this?
So thank you, Beatrice. I'll tackle it from South Africa's point of view, which is the country in which I live and work. You're right. We had in various parts of the country, in almost a sort of a rolling wave, a first surge of infections. And this was timed with quite a harsh, well-regulated lockdown that the country instituted. That was organized in a phased kind of way. And so we went from level 5 and we're currently at level 1. So as Fiona intimates, the strictness of the regulations has eased considerably. And we are even beginning to see more travel now, with even our international travel opening up. So with this, we've also seen an increase in infections, not across the whole country, but in certain regions. And I think it can be said, certainly in what's known as the Eastern Cape province, we're seeing a resurgence of infection there with quite considerable numbers of new cases there. Happily, we're not seeing quite the same level of morbidity and mortality that we saw in the first wave. And that seems to be a pattern around the whole world. So less mortality, except maybe with the exception of the United States of America. So even in Europe, on the second round, it doesn't seem as if the disease has been as quite severe.
Dr. Effiong, we're talking about America here now. What are you seeing in the States?
Well, that was a good thing to mention the U.S. because, as you all know, the U.S. accounts for the largest proportion of cases as well as the largest amount of death given this pandemic. And it's kind of, it's almost, what I say, counterintuitive to think that the country which we expect to have the best healthcare in terms of spending, at least, isn't really showing up to meet that challenge. And several reasons seem to be the cause for this. The reason why we have such a high case counts as well as a high mortality rates relative to other countries. Some of that would be the fact that, first off, we are in a temperate region, and therefore with viruses we tend to have a lot more virus affecting us. But more so is the fact that there's been this political divide where some people are doing their very best to protect themselves, right, and others are, well, throwing all to the wind and literally throwing it to the wind and exposing themselves to the virus and exposing others to the virus as well because of not accepting the truth or the reality of what we face. And when that happens, we find that when people are exposed and infections increase in number, what we see is that hospitalizations increase. And so you have more people going to hospitals because more people are sick. And that overburdens some of the hospital systems. And we find that people also begin to die. And so we see cases lagging behind hospitalization and then lagging behind deaths. And the waves just keep coming and keep coming. And right now, we're not talking about a wave anymore. We're just seeing this thing just rocket and shoot up in the US.
Dr. Atuhebwe, we hear that the virus can be stopped, but as we wait for the vaccine, though, it is thought that 60 to 70% of the global population must be immune if the virus is to be stopped. Is this possible, though, at this point?
The problem with this particular virus is the level of mortality, is that it kills in high numbers, is that the morbidity is very high. People really get sick. And we've seen an overwhelming, our health systems being overwhelmed. Are we ready to expose everyone in the population to the natural immunity that Dr. Fiong was talking about? No, it's really difficult for this particular virus. Therefore, we need, and even if we get the vaccine, how easy is it to get 60 to 80% of the people vaccinated? That will be a tall order. We shall not have that amount of doses. So right now, all the other prevention measures must keep in place. Even with the vaccine, we must keep the sanitizing, we must keep the social distancing, we must wear the masks, because the level of immunity we require is high. We can only manage, the vaccine will only come in to curb the acute phase of the pandemic that we're seeing. It will take such a long while to get everybody at a level to be vaccinated and the population immunity raised to a certain level. For now, we have to continue with all the other prevention measures.
So, Dr. Atuhebwe, before we look at, how long it is going to take for us to get, the entire globe immunized, or to get to that level where the population is no longer, a threat to each other, talk to us about vaccine development. Where are we with that?
So we have so many candidates, vaccine candidates, over 300 vaccine candidates that are being tested at different phases, at different levels, and we have a number of them that have so far gone into human trials. What I can talk about because I know we are discussing Africa and our African countries have gone for the COVAX facility, where in the COVAX facility we are following up a number of candidates. So far we are following 42 candidates that are already in human trials, and we have a number of them that have also reached phase 2B and phase 3, which are towards the end as we get to emergency use listing. So the number of candidates are in the process at different levels, and we've seen hope in the last few days, in the last weeks. We've seen hope that there is hope that we shall actually get a vaccine, and not far from today, but very soon.
Professor Becker, we know that South Africa was involved with some of the trials. Where is South Africa with that?
So, Beatrice, we're with the rest of the world in that we participated on a small scale with the chimpad, or the one that AstraZeneca is now developing together with Oxford, and with the Novavax trial. We were not involved in Moderna. So the two trials that have already shown preliminary results is Moderna and Pfizer. And both of those are messenger RNA candidates and showed very, very good results. The AstraZeneca trial has just also given out preliminary results of about a 70% efficacy. But large parts of South Africa are now involved in the enrollment towards the Johnson & Johnson Ad26 viral candidate. This is a well-known vaccine. It has the platform was also used in and is licensed for Ebola and for Zika. And we've just finished enrolling an HIV vaccine trial. So they're all still in the experimental phase. So South Africa is making a considerable contribution, and enrollment is going well. So this is good news, and hopefully, puts us in a good place to eventually, put in our bid for some access to these vaccines down the road.
So, Dr. Fiong, I want to talk a bit about these vaccines that are showing to be highly effective. But when we say that a vaccine is 94% effective, what does that mean exactly?
Well, what that really means is that for the trial, when the trial was done, looking at the number of people who were exposed to the virus after being given the vaccine versus the placebo, which is usually something that does not contain the vaccine. Now they'll compare those groups and see, well, how many of those who got the vaccine ended up getting the virus, and how many who got the placebo ended up getting the virus in terms of getting infected. And what they found in the Pfizer trial is that, about 95% of the people who got the vaccine did not get the virus, even though they were exposed. Now, these trials are really done rigorously, so they have to say it wasn't a matter of chance. The vaccine was given to these people. They showed a level of immunity, they showed response, and then with that response, they went to the community, got exposed to the virus, and did not catch the virus. And that's the same. They compared the same. They asked the same question for people who got the placebo, and found that an overwhelming number of people who got the placebo ended up getting the virus and getting infected. And so they could confidently come out to say that yes, the vaccine is that much effective.
Are we saying, though, Dr. Effiong, at 94% effective, that is enough to stop the virus circulating?
No. Let's not get over our heads here. 95% effectiveness, again, is in a small sample. We hope that you could extrapolate that result to a global population. But 95% effectiveness is 95% effectiveness. There's still a 5% chance that you could get the virus. So getting the vaccine does not entirely preclude an infection. It does mean that the chance of getting an infection is very little. However, it doesn't stop you from doing the right things you need to do: washing your hands, wearing a mask, keeping a social distance, avoiding crowds, and doing as much as you can to prevent yourself from getting mixed, in a place where you can come in contact with the virus. Because your personal 95% chance of not getting the virus does not necessarily mean you won't get the virus. None does it mean that you won't pass it on to somebody else if you got it.
All right, we'll leave it there for the moment. We're going to take a short break now, and when we return, we'll look at ways to successfully develop and equitably distribute the vaccine. Don't go away.
Life moves pretty fast. Ideas move at the speed of sound. Technology moves at the speed of light. If you don't filter out the noise, you might miss the details. We pay attention to the details because they matter, showing you a different perspective. See the difference.
Welcome back to Talk Africa. Still with me on the program, Dr. Utibe Effiong, Professor Linda Gail Becker, and Dr. Fiona Atuhebwa. Before the break, we looked at how the COVID vaccine development is progressing. Let's now look at successful completion and equitable distribution. Dr. Atuhebwa, before we went to the break, you talked about a COVAX and the distribution mechanism that will be in place, particularly for Africa and other developing countries. Now, the COVAX initiative was aimed at pulling nations' purchasing power as well as donor funding to ensure that there is affordable and equitable vaccine when that does come into fruition. How much has COVAX secured so far?
Is that in terms of vaccines or in terms of funding?
In terms of vaccines.
So far, we have not secured any number of vaccines because we do not have any pre-qualified vaccine, and we do not have any vaccine that WHO has approved for use. The three vaccines that you have mentioned, the Moderna, the Pfizer, the AstraZeneca, have all applied for the emergency use listing, which is still in the process. It's a rigorous process of approval for emergency use listing. However, the COVAX facility has a target of administering 2 billion vaccines by the end of 2021. And these 2 billion vaccines represent the 20% of the global population. And so what we are working on is to ensure that, because one person's problem is a problem for the whole world now when it comes to a pandemic. So initially, there were these talks that Africa, for example, has not been badly hit, so why don't we reserve the vaccines for the other parts of the world that have been hit? But we know that in the case of a pandemic, once one part of the world is hit, then the rest of the parts of the world will be hit. So the COVAX facility is really working on ensuring the equitable distribution. And I don't want us to even discuss inequitable distribution because it's not going to happen. There's a lot that has been put in place to ensure equitable distribution of these vaccines.
And that is what I want to pursue a little further because, as you mentioned that previously it was thought that Africa hasn't been too badly hit, but we are seeing, increased cases though. What is the distribution pattern looking like? What is the plan when it comes to the distribution? Because if you mentioned 20% of the global population, what does Africa fit in there?
So we are actually looking at 20% of each country's population. So countries have been given the information. The COVAX facility is looking at covering 20% of each country's population. The prioritization of which individual gets this vaccine will be done at country level because the countries are best placed to know who in their countries is most at risk, which groups are most at risk and which groups to target. But as for the COVAX facility, what the countries have signed up for, countries, self-financing countries have already paid upfront their co-financing. We shall have subsidized doses for the what we are calling the advanced market commitment countries.
All right. Dr. Effiong, I want to come to you about the cold question of safety because vaccines do tend to take years to develop safely. How have these ones just been developed in like 10 months?
That's a very good question, and I can understand anybody who has any vaccine hesitance because of the speed with which these vaccines were developed. But here is the good news. These we are done under very strict protocols. In the US, we launched what was called Operation Warp Speed with the target of getting these vaccines available, making vaccines available as fast as possible. Now, we did everything we could without compromising the science. And before a vaccine is determined to be safe, we go through phases. Now, there's a preclinical phase for vaccine creation, where you actually start in the lab and you're looking at things and seeing what does this vaccine really do in terms of how when you expose it to animals, and then you gradually go up the chain and get to human beings. Now, by the time we get to human beings, we give the vaccines to a few number of people who we expect not to have a bad outcome. But even then, we are sure that these people might still get a bad outcome. And so it is a very rigorous science that comes into play here, where we expose a few number of people in phase 1 to the vaccine and check if anything really comes out of it in terms of harm. And when we are sure there's no harm, we move on to phase 2 and then phase 3, where some of these vaccines are now, at which point we're able to say this is the right dose and this is how effective it is. And so I think the global population should take confidence in the WHO and in the CDC and in the CDCs around the world that the science is being taken particular look at, and that nobody is cutting corners to develop a vaccine that begin to hurt people. Because if the vaccine comes out and people are getting more side effects or more issues out of the vaccine, then people would lose faith in vaccines. We cannot afford to lose faith in vaccines right now.
All right. Professor Becker, you're listening to this, of course, and we watching this from Africa. Africa is also waiting with bated breath and wondering what the priority will be when the vaccine becomes available. How will Africa, though, how will countries be able to get affordable vaccines for the majority of its population, particularly from a continent like Africa that often, deals with aid or donor aid and hasn't really been a part of the trials itself?
You raise a good point. I think the first point to make is that these vaccines so far have shown us that they can protect us against disease. So I think we're still going to have to see how much they protect us against infection. And so the first round, I think we are going to want to give it to people in whom we know the disease is more severe. And around the world, that pattern has been the same. It's the elderly and people who have other comorbid illnesses. So it seems to me that most countries will be able to make that selection of first going to the elderly and making sure they're protected, and those who have comorbid secondary diseases, diabetes being top of the list there. And then, of course, countries may think they want to go to essential workers. And obviously healthcare workers are very high on the list there because we want to keep them in the workforce. There may be other essential workers that we just know we can't afford to have them down for any kind of time period. And then as more vaccine becomes available, I think we'll be able to roll that down to more and more people. And obviously the young people who are probably the most efficient at passing it around are the ones who are going to be standing at the end of the queue, simply because we haven't seen a lot of morbidity or mortality in young people. Cash is king. So how much it's going to cost is going to depend a lot on what countries can bring in and what they can afford. And then other logistics are very important. So I think it's important that your listeners know that both Moderna and Pfizer need their vaccines to be refrigerated. In fact, Moderna down to -70.
All right, I want to get a final comment from you all, and I'll start off with you, Dr. Atuhebwe, because you talked a lot about the COVAX facility. Will that be enough, though, to guarantee countries a fair shot at the COVID vaccine?
Yes, if the answer is yes or no, the answer is yes. So the COVAX facility has put everything we can put in place. We have big economies that have joined the COVAX facility. We have vaccine manufacturing economies. We are having discussions with the manufacturers. We've guaranteed them the market share, which is what the pooled market demand we're looking at. They've guaranteed us pooled supply. So we can guarantee, we may not have all the doses we need. If we don't have all the doses we need for the equitable distribution, what shall we do? We shall reduce the percentage for every country. If it was initially 20%, we shall take it to 15% until we get enough doses. So the biggest role of the COVAX facility is to ensure equitable distribution of these vaccines.
All right, Dr. Effiong, we may not have all the doses we need at the very beginning, but what must be in place at the global and the domestic levels to ensure that huge-scale development of the billions of potential doses required actually happens?
Well, I mean, there has to be commitments by health agencies and governments across the globe. But, you know, beyond getting the vaccines, it's more important to understand that even though vaccines work, vaccination is what saves lives. It's one thing to get the vaccine out there, it's another thing to get the vaccines into people's arms. And so we have to keep the faith. So we have to answer the questions, the hard questions put out there. We have to keep people connected, keep them reassured, but also make them understand that these vaccines are safe and, you know, and secure. And so it's not just getting the vaccines out there, but actually getting people to accept the vaccines. But more importantly, getting people to understand that even though vaccines are available, right, it is not the time to let the guard down.
Professor Becker, you have the final word.
Just to say that I think this is absolutely right. It's been terrific to see how quickly science has moved forward, and you know, the fact that we have struck gold so soon is terrific. I think the big logistical challenge now around the world is to get these to the people who need it most, and to ensure that once they get there, that people will stand in the queues to receive them. So I think a huge kudos to the scientific R&D and you know, the world at large. It needs global security. It needs global solidarity.
All right, we'll leave it there for the moment. That's all we have time for this week on the program. But thank you to my guests, Dr. Utibe Effiong, a public health scientist physician at the Michigan Health Medical Center, Professor Linda Gail Becker, Deputy Director of the Desmond Tutu HIV Center at the University of Cape Town, and Dr. Fiona Atuhebwe, Africa Region New Vaccines Introduction Officer with the World Health Organization. Remember, we'd love to hear your feedback through our social media handles on Facebook and Twitter, and you can also catch the show on our YouTube playlist. Do keep the conversation going and tune in again next week for more Talk Africa. From me, Beatrice Marshall, and the team in Nairobi, stay safe and goodbye.